Okay, let's talk about ear pressure for a second. First of all, I don't treat ear pressure. It's not something that can be treated with physical therapy. It has to be treated with medicine. That being said, a lot of my patients have problems with feeling pressure inside their ears, and there's something about the anatomy you need to know in order to understand why that is. So your ear actually ends where we can see it with an eardrum, which is just a flap of skin that circumferentially seals that external ear canal, and that is where the wax lives, right in there. Behind the eardrum is an empty space with these little floating bones in it, and then connected to your sinus cavity is your eustachian tube. So if this is really wide open, the middle ear is really wide open, and the outer ear is really wide open, everything should be copacetic. Everything should feel good, and that is how the human ear is designed to work. But let's say that this eustachian tube, which is really tiny and it's full of soft tissue, it's comprised of mostly soft tissue and cartilage, if it is pressurized through some kind of congestion or allergy problem, it will close off and seal off and not allow air movement between the sinus cavity and the middle ear. When that happens, it can cause pressure to build up behind your eardrum and make things feel really pressurized and full in this cavity right here. Because the eardrum is just a flap of skin, it can puff out whenever that happens, and it can feel really, really uncomfortable. It can feel like your ears have pressure in them. So in that case, sticking something inside your ear, say here, into that canal, it's not the answer. Also, blowing air from your sinuses up through the eustachian tube to puff the eardrum out more, well, that might open it temporarily while you're pushing the air through, but it's not the answer either. So that's why doctors will treat this with things like decongestants and nasal sprays, because it's actually better to take something orally or ingest something or inhale something that is going to treat the cells that are inflamed right here that's causing this to swell shut. Also, in extreme cases, they can insert tubes into your ear, which is just making a small controlled hole in the eardrum and putting a little tube in there so that there can be some air exchange between the external ear canal and the middle ear. But that is an extreme case. It's mostly only effective with children, and it does fall out after a few weeks. So it's not a permanent solution either, really. It just prevents things from getting damaged. So if you're having issues with feeling pressure in your ears, think eustachian tube. You want your eustachian tubes to open, and talk to your doctor about getting on some medications that can help.